Hi, today I'll be talking about phobias. What phobias are, the various explanations for what a phobia is or how they occur, and treatments and associated problems with these treatments. Okay, so a phobia is an overwhelming fear and an irrational fear of something that affects an individual's day-to-day life, to the point where it's actually diagnosed as an anxiety disorder by DSM-5 and ICD-10. Phobias can actually be broken down into two categories, simple phobias and complex phobias. A simple phobia is they tend to come about from childhood, and they have four categories: animal, environment, situation and body. So for example, a body phobia would be a fear of vomit or something like that, where the complex phobia tends to occur at adulthood, and it's agoraphobia and social phobias. Agoraphobia is actually diagnosed by DSM-5 as regular panic attacks, fear of having a panic attack, fear of social situations, and also anxiety leading to avoidance, so staying indoors basically. And then we've got social phobias, which is a fear of community almost, fear of interaction, of humiliating themselves in front of people. Clark and Wells explain these phobias as sufferers being self-focused and having a negative image of themselves, but also they seek safety behaviours like avoiding eye contact, and they struggle to get rid of this schema because they don't really communicate to try and get over these things. So we're going to look at a couple of explanations. We're going to start with psychological explanations for each of them. So for the simple phobia, we're going to look at the behaviourist approach, which is called the two-process model, which is based on operant and classical conditioning. The idea is that classical conditioning is actually what creates the phobia. So for example, if a child sees a dog, which would be an unconditioned stimulus, and it creates a fear response in them, and the dog attacks them, then this creates the phobia. And then the idea is that the operant conditioning maintains the phobia, and this is by this individual avoiding dogs going forward, and that becoming a negative reinforcement for that person. So every time they avoid the dog, they never face the phobia, and it's like a reward for them. So that's kind of their view on what a simple phobia is and how they occur, and it's kind of backed up by the research experiment Little Albert, where a rat was presented to a child, which the child didn't fear at all, until a loud noise was associated with the rat. Eventually the loud noise was removed and the fear remained of the rat. So this kind of backs this. With complex phobias, we're going to look at more of a social kind of side to it, because complex phobias are based predominantly around society and interaction. So basically it's based around, it tends to happen at childhood. So when an individual sees maybe a friend or family member hurt themselves or get attacked by a dog, they actually fear that happening to themselves. And it's not just that, they fear the fear of it almost. So this leads to anxiety attacks. So they worry about the anxiety attacks associated with the fear as well. And this is what ultimately leads to agoraphobia. So that's the social cognitive explanation. There's also social cultural explanation. This is based around parenting. So this is based around parenting as well, and basically, according to Aristotle et al. 1983, phobic sufferers lack emotional warmth, or the opposite, they're almost mummy-coddled, and this has been shown in phobics, where they kind of lose their personal control. Although this report could be questionable, because it could just be family members kind of having a go at each other almost. But that's the idea behind that. But the life and experiences are actually highlighted as well in this report. And it was Kilman Marshall that reported 84% of agoraphobics had major family disturbances a month prior to a panic attack. So that's kind of basically just showing that family life can affect phobias as well. So just moving on to the next one. So we're going to look more of a biological standpoint. So this is just physically. And this is basically that phobias are considered an irrational fear. So our body reacts to fear through the fight and flight response. Whilst I can't pronounce this, amygdala processes the threat. So there were brain scan tests actually done to check if this was valid. And although the amygdala did show physical reactions to threats, it created sweat and heart palpitations. The person was not conscious at the time, so it's not really a response to fear, because the person didn't actually experience fear, but it does react to fear. But what did show from these tests is that the fight or flight, an irregular fight or flight response, is what is actually a panic attack. That's what actually happens there. Okay, but linked to this is actually genetics. So family studies showed that simple phobias, most family members inherit that. So if somebody in your family's got a simple phobia, such as a spider, fears a spider, somebody else in the family will likely have that. Now, first degree family members will also present panic attacks. So if my sister suffers from panic attacks, there's a good chance I will also suffer that affliction as well. And this was actually backed by Torgerson in 1983, found that there was a 31% concordance rate with panic disorders for identical twins, against a 0% concordance with normal twins. So the more genetically entwined they are, the more likely they're going to have links with phobia. So it shows that phobias could be passed down genetically. So while we're on that, linked to that is the evolutionary preparedness hypothesis. Now this is based on basically survival. The belief here is that phobias are developed over time through our evolution, and that it was phobias allowed us to survive. So this was actually it was supported by Oast, who actually supported this idea that it was a survival mechanism installed in us, based on a report by Oast claiming that half of all people had phobias or anxious experience around predatory animals and heights, that kind of thing, without ever experiencing them. So how do you explain that fear without them actually coming in contact with their fear, if that makes sense? However, what this doesn't explain is phobias of things that might not be harmful for us now or even in the past, such as a phobia of a balloon. So we're now just going to go on to have a quick look at some treatments. So we're going to look at the treatments, but also the problems associated with each type of treatment. So start off with drug therapy. These work on the neurotransmitters in our brain, just to kind of reduce the ANS, which is associated with panic attacks and increased heart rates. And it prevents the reuptake of serotonin, noradrenaline and dopamine to stop panic attacks occurring, basically. So we're just going to look at a few of the drugs here. So we've got benzodiazepine. Once again, I'm not brilliant with the words. This is a mild tranquilizer. It reduces anxiety and increases relaxation. But however, there is also a however, unfortunately, on all these treatments. They can be addictive, they can become a depressant, and also they're linked with dementia, specifically in older people. We've also got beta blockers, and these suppress the noradrenaline, which we spoke about a second ago, slows the heart rate and lowers the blood pressure to try and alleviate panic attacks or phobic reactions. However, this also leads to depression, sleep problems and stomach problems. Now this one I've struggled to say. It's monoamine oxidase inhibitors. So I apologise for that pronunciation. It prevents the breakdown of serotonin and noradrenaline. So it reduces anxiety and basically reduces anxiety attacks. But this also has problems associated with it, such as agitation, dizziness and stomach problems. So although there are treatments out there, There's always a however, unfortunately. Drugs are considered to be better for the short term, and alongside therapy can be very effective though. So now we're going to look at a biological explanation. So there's treatment. Biofeedback is basically a therapist teaching somebody relaxation methods to lower the heart rate and reduce panic attacks. This is the procedure for this is basically relaxation techniques are put in place. They are then connected with electrodes, and this is to monitor the skin conductivity. Conductivity is increased by sweat, which is produced by increased heart rate, which is associated with panic attacks. So if they can monitor this, the individual can learn to regulate their own panic and their own heart rate, basically. And the eventual goal here is to make somebody be able to do this without the machinery, if you know what I mean. So know how it feels, so they prevent panic attacks themselves. However, this does require practice and a deep understanding of their own condition and acceptance. So these treatments there are treatments around, but it's how effective they are, and there's always ways. There tends to be a lot of problems associated with them. Okay, so we're going to look at some behavioural therapies that are available. So this is the systematic desensitization. So basically the aim of this is to remove the fear response and introduce a relaxation response. Okay, so the procedure for this is actually teaching relaxation through breathing and stuff that we spoke about already, but then create a hierarchy of fear. So if the fear, this is specifically good for simple phobias, is a spider, and the thought of holding that spider is traumatic, but looking at it from a metre away isn't too bad. The idea is to put the spider a metre away, slowly introduce it step by step while monitoring the heart rate till the spider's in their hand and they've managed to face their phobia. The problem with this is that it requires a lot of bravery from the individual. It requires patience from the therapist and the individual. And it's very specific to simple phobias, so it's quite hard to pass that to complex phobias. Another behavioural theory is flooding. Now this goes against relaxation methods once again. It exposes a phobic to their worst fear, basically. It puts them in a room with their phobia. So if you're scared of dogs, they're put in a room with a dog and they're told to go and stroke the dog. The idea behind this is anxiety can only be maintained for a certain amount of time. It can only be held for a certain amount of time. So it will gradually decrease and they can deal with their phobia and overcome it. However, this does take a lot of bravery, and there isn't a big completion rate with this because obviously it's quite a traumatic experience. So all these treatments unfortunately do come with a however. So we're just moving on now to a cognitive approach. So this is like therapy basically. It's identifying a negative thought and turning it into a positive thought. And this is done cognitive in two manners. There's a cognitive restructuring, which basically here rationalizes irrational beliefs to cope with the phobias. So basically, people are aware that it's irrational, and it's just building it up in their mind to make it rational. And this can be done through thought stopping. But basically, if they start feeling negative effects, they say in their head, stop, and they try and focus on it being positive. This is done with a therapist, obviously. And there's a cognitive rehearsal, which is a mental rehearsal of a positive situation. So it's rehearsing in their head, fighting this phobia and doing it in a positive way. So it's all in the mind, basically. However, it does require a lot of commitment and only deals with the problem at hand. So it doesn't really look at the root, it just deals with that phobia. Okay, so just to finish, there's guided imagery approach, and there's two methods that I've looked at here: hypnotherapy, sorry my words again, and mindfulness and meditation. Basically the hypnotherapy is communicating with the subconscious through positive images, talking with a therapist to relax, taking nice breathing exercises, but all visualizing. And it's to change the feeling towards the phobia itself. So it's positive thoughts basically. And this one here is a meditation, mindful meditation, which can be done through yoga, for example, or just meditation, and to alleviate stress and anxiety. Just allow the ANS and just a feeling of well-being all round to fight phobias. However, this is dependent on relationship with the therapist. Same with therapy. it relies on a good relationship, and it's very dependent on the willingness of the patient. And they've also got to be willing to change. So just to conclude, phobias are very complex, and they can present themselves to differently to everybody, meaning there is no real clear answer to why they occur or where they definitely stem from. However, each of these theories allow an understanding of where they might originate, whilst also being backed up with substantial evidence and support. Where treatments from phobias clearly do not have a one-size-fits-all solution, with drug therapies having physical side effects and behavioural therapy exposing patients to severe stress. However, each method offers something different, allowing treatments to become individualised for a specific trauma. For example, guided imagery would be more effective for people suffering from simple phobias than cognitive approaches, where cognitive approaches are better for longevity for the long run than drug therapy. So, however, the one thing that is evident is that the relationship between the patient and the therapist is crucial on all of these, and it also takes a willingness and understanding from the patient to want to overcome their phobias. Thank you for your time.